In this video, we are doing a follow-up for a patient. So we saw her last week or 2 weeks ago for lip filler, and now she just has a little bit left. So we are going ahead and just doing a enhancement. This is also her second syringe. So she already had one syringe of filler. She has this pucker, kind of like almost like a rolled in lip on the bottom. So we're just kind of focusing on pulling that out a little bit more. She wanted just a little bit more volume medially here. You can kind of see from some angles, it just almost puckers in. We tried correcting that with the first syringe, then we went in with a second just to give her the volume that she was looking for. So I'm just placing that and then just trying to massage it into that divot. You can kind of see it a little bit there when the lighting hits it. We were just trying to pop that out a little bit more. So I just went in with 0.1, gave it a really good massage, and I was happy with the results that we got there. Now we're going in with just the rest of our syringe into this patient's nasolabial fold. For this patient, we are really focusing on collagen stimulating treatments. So we are focusing on threads and microneedling, RF microneedling, Sculptra. We've done a few different things so far, and we have some treatments planned out for the rest of this year as well. Her biggest concern is that skin texture around her mouth. And unfortunately, filler is not going to be your best option for that area. Really, we want to focus on that skin quality and producing collagen. But we had a little bit of Versa left. And if I am going to put anything into the nasolabial fold, I do like this product. It's very versatile. It's smooth. It moves with the patient. So she was just wanting to put the rest of this just to help smooth a little bit. But for this area, I always like focusing on the mid-face before going ahead and filling the nasolabial fold. Really filling in this area with too much filler can make the area appear bulky. So it's really important when you're consulting with your patient to understand what their concerns are and what's going to be best as far as their treatment planning. So we never want to fill this area up too much. It can just end up looking really unnatural. So I'm just doing some fanning here, just placing a little bit of product, again, just to help smooth. If you are doing nasolabial fold, like I said, just focus on mid-face and cheek first, and then going ahead and adding a little bit to the nasolabial fold can really pull everything together. For this area, we do need to be aware of our anatomy. It is a level 1 injection as far as AAFE coursework goes, but we are right over that facial artery. So just making sure you're being aware of your depth and your injection technique and always aspirating as well. I did a little bit just in her oral commissure to help perk up the sides of her mouth here. Just a little bit on each side, nothing crazy. Again, we were just kind of blending in what we've already done. And we will be seeing her back for, I believe, Sculptra or PDO Smooth Threads here in a couple of weeks. And she also has done one session of RF microneedling, so we are going to be going ahead and doing a few more sessions of that as well. Again, just going to the other side and doing a little bit in her oral commissure. I'm tenting up and making sure I like my depth before placing. And of course, we're going to go in and just do a massage at the end just to make sure everything is smooth and integrated into that tissue. We don't want any lumps or bumps. And I don't let the patient massage at home. I try to do everything in office so they are ready to go. And then I will see them back in 2 weeks to make sure everything is the way it should be.